Don't underestimate the power that improving your baseline level of health can have on your chronic pain. I think sometimes people kind of scoff at this or just overlook this. And maybe it's just because, there's big shiny things out there like peptides and PRP and stem cell therapy and stuff like that. But I also think a lot of patients have tried certain things and they haven't seen improvements in their chronic pain. And so they kind of give up on this, nutrition, lifestyle, sleep hygiene, exercise or physical therapy kind of approach to chronic pain. And sometimes that's just because the right approach wasn't taken. So someone may change up their diet and they may go on a vegetarian diet and they don't notice any improvement in their symptoms and go, well, just changing my nutrition doesn't matter, so I'll just go back to eating whatever I want, when I want, how I want. When in reality, it may have just been that the vegetarian diet wasn't the right diet for you, because there are lots of people who will see significant reductions in pain by switching to a vegetarian diet. Or someone might try the vegetarian diet, it doesn't work, and need to switch to something like a keto or a carnivore. And so just because one approach doesn't work for you doesn't mean you want to kind of give up on that. The other reason that I think is that people kind of don't really give this a shot is, one, they think that their pain is too far gone, or that the pain is too severe for these other things to kind of make any improvements, and so they just think that they need something big and drastic. And that is, that's true in some instances, but in a majority of cases, improving your sleep, nutrition, hydration, exercise, your support system, all those things can have dramatic improvements on some of the worst chronic pain. When you can start to bring down inflammation levels by sleeping better, moving, and eating what your body is going to agree with instead of not agree with, it takes time for sure, but that can be huge. And so the last one is that time piece. I think some people just don't give this enough time. They start doing something and they try it for 4 weeks, maybe 6 weeks, 8 weeks, and they don't really see improvements, or they see minor improvements, and so they kind of give up. These lifestyle changes sometimes take a lot of time to really have an impact. But the upside here is that the impact that is seen is often much more longer lasting. And so if someone is able to really devote 6 to 12 months on saying, look, I'm really going to overhaul my life. I'm really going to place a focus on sleep. I'm really going to change my nutrition. I'm really going to start, doing my PT exercises or get to the gym. I'm going to start doing things in life that I love. I'm going to go quit this toxic job. I'm going to leave this toxic marriage, whatever it is. You give that time. One, the benefits can be profound, but two, those benefits often last a really long time, especially when that is maintained. That is much better than just going to get a quick cortisone injection that's going to give you 3 months of relief and then your pain comes back. So don't underestimate the power that just basic foundations of health can have on your chronic pain.